Hi, everyone. This is Sarah Finkelstein with Signature Advisory Group. I have a guest here with me, and we are going to be talking about Medicare. And Stacy lives in Georgia.
Yes.
And Stacy, I know you're not yet 65 because you don't look anything close to 65. And we all know that 65 is the magical age where people qualify, become eligible for Medicare. And so, Stacy, tell us, how is it that you're so young and you're on Medicare?
I have a rare condition called trigeminal neuralgia, which affects the nerves inside of my face and head. And basically, I get electrocuted. It's awesome, as well as multiple sclerosis. And so I'm on disability.
Okay, so you're on Medicare disability.
Yes.
And for our listening audience, just so you guys know, once somebody qualifies to be on Social Security disability, after 2 years of that, the individual qualifies for Medicare. So there are people in the country that are younger than 65 who are on Medicare because of a disability, but everybody else gets Medicare, or I should say qualifies for Medicare at age 65. So Stacy, tell us, what kind of a Medicare plan are you currently on?
I am on a PPO.
A PPO. So that would be a Medicare Advantage plan, right?
Yes. Mm-hmm.
Okay. And for our audience, there are differences between original Medicare and a Medicare Advantage plan. And just to put that out there, original Medicare allows you to go to any Medicare provider anywhere in the country, whereas a Medicare Advantage plan is a network-based plan. Although with a PPO, you can go out of network, but it's really up to that provider. It's up to them whether or not they want to accept the plan and the plan's terms. And how long have you been on your PPO plan?
I want to say maybe 6 to 8 years. It's been a while.
Okay. And during that time frame, you've been on the same plan throughout?
Yeah. Mm-hmm.
Okay. And so that's a long time to kind of sample how a Medicare Advantage plan works. What would you say that you like most about the plan you're on?
I do like being able to find my own doctor. And with trigeminal neuralgia, it is rare. So to be able to find a neurologist that's seen another patient like me, and I have a very rare form of it. We went through probably 7 neurologists before I found one who understood it. And so I was able to pick my own doctor in that way. So I did like that.
That's great that you found somebody that was suitable for your needs.
Yeah. Mm-hmm.
And sometimes it does take trying different medical professionals till you hit the right one. So
yes.
It's good that you found the right person. What would you say that you like least about your Medicare Advantage plan?
The fact that they can change the cost of it. They can up the premium or the copays. I think it's yearly.
Yeah, absolutely. You're right. The Medicare Advantage plans are not only network-based plans, but they're also calendar year plans. Mm-hmm. So the plans this year in 2021 are, many of them, slightly different from the same carrier's plans the year before. So they do change from year to year. And you probably get around September time, I'm guessing, is when you get a booklet from your provider, not your provider, from the carrier, from your PPO plan, letting you know what is going to be changing inside the plan. That's called an annual notice of change, or as we refer to it in the industry, ANOC, for annual notice of change. And that lets you know what's going to be different. Sometimes they add benefits, sometimes they reduce or modify benefits. And copays is one of those things that they can change. They can make them more, they can make them less.
Yeah,
Right.
I wish they had something for people in like my situation. My specialists are my primary care. I have to see them monthly. And through I see pain management as well as neurology, and those copays are much higher. And so for me, I'm instead of paying a primary care copay every month, you're paying a specialist copay every month. And that's something I wish was kind of out there, that we could lower that copay.
And so just out of curiosity, what is the range of the copay that you have to pay to see a
50 to 75
And so how often do you see specialists in a
every
month?
month.
Just one
I see
specialist?
two specialists every month, every 30 days.
Okay, so roughly $100 to $150 a month
Mhm.
in copays to see your specialists.
Yeah,
Okay. And yeah, wouldn't it be nice if there was something out there to help you
yeah.
save money?
And most people with MS would actually have three. I'm not participating in one of the programs that would require a third specialist. So,
Okay, yeah. Actually, you remind me of a situation where I was helping out a client who went on a Medicare Advantage plan for the first time when she turned 65. She didn't really understand the differences between the different options available to her. I was not the
mhm.
one that helped her at that point. Actually, she had an agent that went to see her. He represented one carrier and he says, "Here, sign." And she did, and was a Medicare Advantage plan. And people don't expect to have any issues. None of us do.
Yeah,
We think we're going to be perfectly healthy forever.
yeah.
And she encountered a situation where she fell and she broke her knee and she had to have surgery and had to go for physical therapy. And physical therapy, her copays were $50 each time she went for physical therapy. $50 3 times a week was
Mhm.
$150. It was, really adding up. And her husband reached out to me because he knew me and he says, "Hey, we've got the situation. Is there anything we can do?" And fortunately for her, because she was within the first 12 months of trying her Medicare Advantage plan, she was able to leave the plan, go back to original Medicare, and get a supplement plan without having to answer any health questions. So she jumped on the
Okay.
bandwagon with that. And because it is a difficult, not a difficult, but you have to know the proper terminology, I got involved with Medicare to help her get that done. And then she got the supplement plan. So instead of having to pay all those copays, she just pays a monthly premium and it covers everything at 100% for her.
Oh, good.
Yeah, not including drugs, because drugs are under Medicare Part
Yeah.
B, and that's counted separately.
Yep.
But she's a very happy camper because now she doesn't have to worry. She doesn't have to count her pennies, and she can just take herself to any Medicare provider that she wants to. And her supplement plan pays her portion, so she never has to write a check when she goes to the doctor or hospital or anything like that. So when what words of wisdom would you have for somebody that's let's say turning 65 and wanting to make a decision about whether they should go with a Medicare Advantage plan or a Medicare supplement plan? What do you have? What tips do you have?
I basically, to do your homework, um, to learn what fits your specific needs more, and then to speak to someone like you to help understand, because there's a lot to learn. There's a lot of information, and it can get confusing. So you really need to get in there and find out what's going to work for you before you sign anything and sign up.
And that's a good piece of advice because I do hear that frequently from people say, "I'm so confused. I'm overwhelmed. I'm getting 10 phone calls a day from different agents and insurance
Mhm.
companies." And then some people get conflicting information from their friends and neighbors because some people will let them know, "Hey, I'm on this client plan. You should do that." But everybody's situation is different. And it's an important decision not to be done hastily and preferably to be come to a decision with the help of a professional who can explain the differences to you so you can make a wise decision. Because sometimes if you go on a Medicare Advantage plan, you may not have the option to get a supplement plan. It really depends on your health. So for example, people who, let's say, try a Medicare Advantage plan at 65, and then when they're in their 70s, they've developed some health issues, they're paying those copays to see various specialists, it adds up. And now they want to go back to original Medicare, be in control of who they go to see without any network restrictions,
Yeah.
and not have to worry about all those copays. Well, you can always go back to original Medicare. That's not an issue. But the issue comes in getting a supplement plan, a Medicare supplement plan, also known as a Medigap policy. So it is an important decision, not to be taken lightly. And it's important to be aware that you may not have an opportunity to go with a Medicare supplement plan later down the road. Now, for you, Stacy, being that you're so young, when you turn 65, you will have the opportunity again to decide which way you want to go.
Which way I want to go.
Yeah, you'll have an opportunity to get a Medicare supplement plan at the same premium that any 65-year-old at the time would have to pay. But if you were to go on a Medicare supplement plan now, because you are on Medicare disability, you'd be paying a whole lot more for that Medicare supplement plan than a 65-year-old, simply because of the Medicare disability status. You might be paying 2 to 3 times as much for the very same thing that a 65-year-old. And yes, it is important to understand your choices and options, which is why we do monthly workshops about Medicare. And for anybody that would like to join us, we do Medicare and Social Security workshops. And if you want to enroll in that, just go to www.medicareonlineworkshop.com. And of course, if you have any questions, feel free to reach out to me. There's no cost, there's no obligation. I'm more than happy to help. And my phone number is 561-302-5760. Again, this is Sarah Finkelstein. And Stacy, is there anything else you want to add?
Just to be safe.
Absolutely. Be safe and be healthy. And thank you for listening. And thank you, Stacy, for joining us today.
Thank you.